So there's 8 levels of hiring great physical therapists, and most owners, they're stuck at level number 2. So hi, my name is Dr. Robbie Woelkers. I'm one of the physical therapists and co-owners here at RehabCEOs. We're an 8-figure agency that works with physical therapy practice owners, and we help them by growing and scaling their clinics. And we do that with done-for-you marketing, executive coaching, also recruitment and staff training. So recently, one of our clients was complaining that they weren't hiring any physical therapists. And when I leaned in a little bit and started asking some questions, it became super obvious where their breakdown was. But I always ask them, like, where do you think your constraint is? And they're like, well, we just can't get any applicants, or we can't get anybody to accept our offers, or, that we hear it all. So what I want you guys to understand, I want you guys to focus on, is that most physical therapists spend about 95% of their time on marketing and like 5% of their time on recruitment and talent acquisition. And I think that's really interesting because it's like we fill our location, we spend all our time trying to get full, and then we spend like a little bit of time on actual recruitment. So I took them through my framework for hiring, and it became pretty obvious where they were stuck. And which is interesting because where they were actually stuck was a little bit further down in the pipeline than where most owners do. Most owners actually get stuck at level number 2. So I want to introduce you guys to something called my provider framework. Okay. So what we're going to do here is I'm going to walk you through each one of these levels. And we kind of look at this thing like a marketing funnel of sorts. And it's really easy for us to be able to see like where owners are getting stuck at, because we want to start at the top and we want to kind of work our way down. And it was interesting for this owner is just like, well, I can't hire any physical therapists. It's like, well, okay, well, let's look at level number 1. Is that good? Yeah. Let's look at level number 2. Are you, getting applicants? Are they clicking on your ad and stuff? Yep. Getting a ton of applicants. Awesome. Right. So we started to go down to the process and like, that's where you're getting stuck. Cool. Fix that. And then now they're able to hire. Right. So what I want to show you guys is number 1, this is all about going to be your package. Okay. So we would need to be able to create really, really good bait before we go fishing. Okay. So we want to make sure that we have a really good package. And I'm not going to be able to cover like all of these today, right? Just for sake of time of this video. But I want you guys to understand the package could be broken down into 4 levels. It's going to be your salary or wage, right? So that's going to be number 1, salary. It's going to be your salary or wages. It's going to be your benefits. It's going to be your offer enhancers, or it's going to be your vision. Now, we want to be able to, because we got to create a vision that's so big that people could fit their career inside of it. So wages is going to be more or less your salary, like what you're actually paying people on an hourly rate. It's going to be people like what we pay people on a salary rate. And is it competitive for the marketplace? Now, I want you to understand that if you have the provider or the patients, but you don't have the provider, you're losing about $5,000 a week for every week that goes by that you don't have a provider to see your patients. You have the patients, right? You have the demand, but we don't have the actual supply or the fulfillment to be able to handle them, right? So realistically, like some owners will start to like, well, I can't afford that. And it's just like, well, you can't afford not to do it. So just a heads up on that. Benefits, one of the easiest things that you can do is look at all of your competitors and their ads. What benefits are they offering? And then you try to also offer those. And if you can't because money's tight, there's other things that we can do in a second here. But we want to be able to see, like, do they offer health and dental and vision? Do they offer student loan, repayment? Do they offer fellowship residency? Do they offer? And then the moment we can get as many as we can that our competitors are often, because we want to be, when they're comparing, we want to offer some of the same stuff. Okay. Now, one thing I will say here with benefits is that I'm not a big PTO guy. So I think 2 or 3 weeks is fair, or like 80 to 120 hours of PTO, because patients count on us to be there. And every week that, we're not there and I'm paying somebody, it's $5,000 loss in revenue, but then it's also I have to pay the PT for that time. So it's like a $7,000 swing for an owner to have providers that are just not there. So again, in healthcare, I'm a firm believer that patients count on us to be there. So if people want like 4, 5, 6 weeks of PTO, healthcare might not be for them. Okay. So offer enhancers, what are those? Those are structured mentorship, career ascension, career advancement. It's going to be sign-on bonuses, and then it's going to be profit sharing, right? Those are the kind of the core for offer enhancers. So if you don't have a structured mentorship program, you want to map that out and show exactly what that looks like. If you don't have career ascension, like you start as a new grad, you go to a junior PT, you go to senior, right? This is our business track. Here's our clinical track where you start as a new grad, a junior clinical instructor, a senior clinical instructor, director of clinical, and then so on and so forth, right? You could have same thing for front office. And ultimately you want to have like, here's where you are. Here's what the tiers look like. This is what you could be making in just about 5 years. By the way, we have COOs. We have, you could be our CMO. You could be even a partner. And this is what that plan looks like. So career ascension, and then offer enhancers like sign-on bonus. Again, it's costing $5,000 a week to not have a PT. So you could probably give them some of that. And then the other thing is like profit sharing that you might want to be able to leverage for once they're a star performer. You're going to be able to share some of your profit with them. And then finally, for, if you don't have all that stuff and money's tight, it's like you need to sell that on a vision that's so big. And, recently I had a practice owner, they're like, what if I don't want a big vision? I'm like, that's why you're not hiring anybody, because you don't want a big vision and you're not attracting people. Law of attraction here is just like top 10 talent. All right. They want top 10 or level 10 opportunities. You got to create a vision that's so big that people could fit their careers inside of it. And if not, maybe that's where you need to do a little self-reflection, because you're like, well, I just want to be small little clinic. It's just like, well, then you're going to attract people who want to be small little clinics, which not a lot of people do. People want to grow. People want to expand. Okay. So that is going to be the package, right? So we got bait now. And then all of a sudden we're going to drop our hook in the water. And, this practice owner, I said, well, let's go ahead and look at your salary. Let's, increase that. Let's go ahead and add a couple things for benefits. Let's go ahead and add some offer enhancers and vision, because now I want to create a total compensation package, right? So now instead of saying you have like an 80 to 85K salary, it's like our total compensation package is like 135K between PTO and, 401k plan and covering your FICA and doing all this other stuff. It's like we put that all together. So when we actually list it out, like we put that stuff in. It's pretty cool, right? So the next thing that we're going to look at is R. R stands for recruitment. Okay, recruitment. So the cool part about recruitment is you could take recruitment and you can break that into 4 categories. So you have inbound, okay? You have student clinicals. We have our provider 25. I'll explain that in a second. And we're going to have outbound, right? So inbound, this is going to be more like your Indeed ads, but more specifically, this owner, we were talking to them. We're like, okay, well, are you getting clicks onto your ad? And by the way, Indeed recently used to be free. Then they used to charge a fee, and now they're going to like a little bit more premium and tightening things up. It's actually kind of cool to see what they're doing. They went from like fee and they were attracting like people, cheapo people. Now they're like, they were free, excuse me. And they were attracting like freepo people and cheapo people. Now they were starting to charge a fee. So think about it. Like most owners don't even want to pay anything to recruit. So if you were willing to do sponsored ads on Indeed, you crushed. And now people are starting to come around and paying money. And now if you want to pay like the premium services to be able to offer some of this stuff, now that's kind of where most of our rehab CEOs sit. They're the ones that are, if like you have problems that money can solve, like you don't have problems. So they are more on the premium side of things, which by the way, like I say premium, like we're talking like $5,000 to $1,000 a month for recruitment. Like a recruiter is like 10 to 15, 20 grand placement, like a percentage of the salary. It's pretty cheap in the grand scheme of things, right? But again, if you have problems that money can solve, you don't have problems, right? And if you don't have money, we just have to be more resourceful. So inbounds, we look at a couple things here. We're looking at, first of all, what platform are we using? Second is like, are people actually clicking onto your ad? And you can see that. You can see the data. And if the answer is no, okay, well, your snippet, which is going to be the title, right? Your company, right? Your reviews, your title of your ad, and then it's going to have like your little salary ranges, right? That's not appealing enough. That's the hook to get people to come into your ad. Now, if they read your ad and they don't actually apply, then that's a copy issue. Right. So if you're like, oh, corporate jargon, we're looking for someone, this is a no BS clinic. We need someone to show up on time. Like, get out of here with that stuff. Versus if you come over here and you're just like, hey, we are trying to become the best physical therapy clinic in Northern Virginia. And our mission is to, and here's our vision, and here's where you fit in. And these are the problems what we're trying to solve. And people are like, whoa, by the way, we offer structured mentorship. We offer career ascension. We offer. Go ahead and click and apply. And people are like, this is amazing. So now all of a sudden, it's just like we have Indeed strategy or we have an inbound strategy working. Okay. Now we also said there was a couple other here's. Most of you guys, hopefully you have student clinicals, right? So we have inbound working for us. we have our student clinical pipeline. We should have students first year, second year, third year in our fall, spring, and summer clinical pipelines. Okay. So you could have 1 to 15 universities that you're getting students from, but each one of your providers should have a student in the fall, spring, and summer. Now, if you guys are getting student fatigue and I just want to take a break from students, it's fine. If you don't want to take on students, that's fine. But I'm here to tell you, your competitors are. 40% of new grads are accepting positions at their clinical, and newer research shows that most orthopedic or outpatient clinicals are in their second year, right? Either in their first or second semester. Third, they kind of pick to see whatever clinical they want to actually do afterwards. So just know that like that second year is where most people are scooping up PTs because they're doing delayed starts and they're getting people in their pipeline. So when you first start getting students, it might take you like 6 months to a year to start hiring people. But once you do and you're in that cadence, it's awesome. Okay, so student clinicals. Provider 25. If you guys ever read the book, The Ultimate Sales Machine by Chet Holmes, there's a thing called the Dream 100 in there. So basically what we are going to do is we are going to make a list of 25, not 100, but 25, right? So we're going to make a list of 25 individuals that are in front of either students or other providers, okay? So what I mean by that is like you might want to put like 5 or 6 or 10 universities, specifically the clinical coordinators on there. So who is actually assigning students to clinical coordinators? You want to put them, their name and their address on there because you want to remain top of mind and you want to be able to build a relationship with them. You might want to become an adjunct professor. You might want to do roundtables. So who's the roundtable coordinator? You guys might want to be able to sign up for APTA or CEUs. A really good referral source is a dry needling CEU course that is in town. And you could host at your own facility and invite people to it. Now it's right. So who else, right? Who else, right? You guys could start having little meetups or whatever that looks like, or, you know, an administrator in a Facebook group where all these PTs like, right? Also a great one that was recently mentioned is these people that help with the MPTE exam prep, right? Get in front of those because they're helping people. And it's like, hey, you know, you're helping people pass. They're probably going to want a job, right? Because they're nervous about passing, right? Let me be part of your Rolodex of people to supply. So now all of a sudden, it's just like you're building 25 people who are in front of your students and other providers. So when you have a job come up, you could hey, you could ping them and be like, hey, like, who do you know? Okay. And then the last one here is going to be outbound. So outbound basically is, you know, you're going spearfishing and we're trying to find the fish and then we're trying to hook them in. So this could be like, you know, sending DMs over on LinkedIn or Facebook. This could be hiring recruiters, people that are doing it for you. This is smart sourcing over on Indeed. This is Recruiter Lite over on LinkedIn. So this is where you're actually going to get a list of people who are currently looking for jobs, and you'll be able to start messaging them and building relationships. So that's more outbound, okay? So you're like, well, which one do I start with? Start with inbound, students, then go to provider 25, and then go to outbound. Okay. So that is where, when we were helping this owner out, like they actually did a pretty good job with that on the recruitment side. Now, where they struggled was here. Okay. So by the way, most practice owners get stuck here between the package and they're only doing one recruitment thing because people would be like, well, I'm doing Indeed. I'm like, yeah, but what about all this other stuff? Or they'll be like, I hired a recruiter. I'm like, great. Well, unless your recruiter has a, you know, stipulation that you can hire other recruiters, it's like hire 5 recruiters. Because if you pay for performance, then get 5 recruiters and let the best man or woman win, right? But at the same time, you need to have all core 4 operating for you, okay? So then the next thing is opt-in, which is really cool, right? So I don't know why I put ORT, but we're just going to put opt-in. So there you go, opt-in. Okay, so once you get someone to apply, holy smokes, right? I need you guys to be less than 24 hours to respond. So Indeed actually released an article that they're noticing that by the time they apply for a job and they actually get hired is less than 7 days. Less than 7 days. So we need to make sure that when someone applies, you're getting back to them as quickly as possible. Now, do you have to interview them that day? No, but at least like email, text, message, phone call, check in, see how they're doing. Do they have a pulse? And then be able to set up an interview, right? Or the next thing that you're going to learn is vetting, like vet them that they're actually a good fit and then move them into an interview. Like, I can't tell you how many owners I'm like, hey, you have an applicant. Did you see it? And they're like, oh yeah, I'll get back to them. We follow up a couple of days later and they're like, yeah, I've been busy. I've been treating patients. It's like, what are we doing? So I'm here to challenge you guys that if you get applicants and you're not responding to them within the first 24 hours with a human touch, then stop hiring. It's a waste of your time because we have to have speed to lead. We have to be done fast. We have to do it right. So I'm telling you right now, your competitors are going to be quicker than you. Now with AI and automations and responding and stuff like that, if you get applicants and you're not responding to them, like if you got ads up, you should have your, like at your desk with your, your patient, if you're still treating, like as soon as that pings that you got an applicant, like you should get notified and be able to respond. If not, have someone on your team get notified. Have your front office get notified. So when you get pinged, they get notified so they can let you know. Anyways, I'm on a soapbox here because this is where this owner got stuck. They got stuck here. It wasn't their package. It wasn't recruitment. It was the fact that they were responding too late. Then the next thing that we want to do is we want to vet, which vetting is really interesting to me because some of us put an ad up on Indeed and, let's say you're going fishing for like smallmouth bass or largemouth if you get a largemouth bass. And which is kind of right. The big, right. It's a big bass, little bass. Anyways, largemouth bass is what you're shooting for, but you might catch like a sunny or a perch, or you might catch like a bluegill. And you're kind of like, yeah, it sucked. Yeah, they ate my bait, but I have more bait. I'm going to put it back on the thing and go fishing again. All right. Or I might even lose spots. Right. But you're not going to not fish again. So I can't tell you how many times like owners will be like, oh yeah, I had someone apply like a store clerk. Like, can't they read? And it's just like, Indeed sucks. And I'm like, okay, like, so if you fight for your limiting beliefs, congratulations, you get to keep them. Like if you think that that's like, yeah, you might get some fish that bite that aren't the right fit. And that's why you have to vet. And that's why we have to have this process here because you're like, oh, cool. I'm going for largemouth provider. Or I'm going for smallmouth, physical therapy assistant. Fine. Awesome. They're on. We hooked them. Or I got a sunny, I got a bluegill, I got a crappie. Just throw them back and rebait and relaunch. Right. So that's going to be the more the vetting process. But vetting here is we also want to make sure that there's some level of alignment. Do they align with us? Do they want to be an outpatient? Right? Do they just graduate? Are they waiting to graduate? I check some of their resources or their, letters of recommendation, right? Or their referrals. And I want to vet them and make sure that they're good. And then what I want to do is I want to invite them to an interview. Okay. Interview. Now, my feedback on interviews. Okay. My interview process is I want to make sure that they are a good fit for the role. I want to make sure that they're a good fit for the department. I want to make sure they're a good fit for the company. And then I want to make sure they're a good fit for long-term vision. So I'll kind of work my way up. So I don't start with mission, vision stuff here. I just say like, hey, from a role, here's the job description. Does that feel like something you would want to do? Are you comfortable with that EMR? Are you comfortable with 40-minute scheduling? Are you comfortable with AMA versus CMS billing? Are you comfortable with being more manual and functional based versus whatever? Right? Are you okay with this population? Then, hey, these are the cadence. This is what we do weekly meetings. We have Slack. Are you cool with all that stuff? Awesome. From a company standpoint, here's our mission. Here's our vision. Here's our core values and goals, right? Does that resonate with you? And then finally, where are you trying to go in your career over the next 5-10 years? And here's where we're trying to go. I just kind of go right up, get alignment there. So that's the interview process. Also, you need to understand when you're interviewing somebody that it used to be, I have a clinic. Why should I hire you? Now it's, I have a license. Why should I work for you? And by the way, I have other people courting me as well. So it's kind of changed. So that being said, you have to sell people on why you're the best option for them. Now, you don't sell people on the features. You sell people on the future. Well, you said that you want to get here in your career, and we could offer that because we have structured mentorship. We have career advancement. We have a big vision. You'll be able to fit yourself inside of that. Now, if you're like, well, we offer these benefits, and no, those are the features. Okay. So we want to make sure that your offer and your package and everything that you're doing for them resonates and aligns with what they want. And then it's a simple yes or no, right? So that's where we go into the next thing here, where we make a decision, which, by the way, right? Decisions are kind of cool because you are either going to accept or deny them, right? And then if you offer them a position here, they could either accept or decline, right? So if we're kind of looking at this thing here, right? there's really like so there's going to be like you offer and they accept, you offer and they decline, or you decline and they never had a chance. So realistically, there's like a 1 in 3 chance or like a 33% chance that they are going to accept and you're going to offer and they're going to accept, right? So that's why, this stuff is difficult because there's only a 33% that you and them are going to be both in alignment, and you're going to be like, I think this would be a good fit. And they're like, I agree. And then make that a connection here. Now, one of the things that we like to do here at Rehab CEOs, well, if you make an offer and they don't accept, well, we do an interview. What could we have done differently, or what can we do to get you to say yes? Or if you say no, I'm a big fan of just letting them know why, right? Everybody deserves a little bit of feedback, right? Which is really important. So that's going to be a decision. And then ultimately what you want to be able to do is enroll. Okay. So Harvard Business found that one of the main reasons why people get frustrated with their job is because of poor onboarding. Onboarding is all about setting expectations. What does good look like? So we need to be able to bring somebody on, and this is the proof, because they just accepted your position, and now we have to give them proof that they made the right decision to work for you. So you want to be able to do a 30, 60, 90-day onboarding, right? There's pre-onboarding before they even get started. There's the actual first week and first day, and then there's a 30, 60, 90-day plan afterwards. Low-level skill set, moderate-level skill set, high-level skill set, functioning PT, and now they're off to the races here with a full schedule, okay? So that's going to be more the enrollment period. And then finally, guys, the last thing here is going to be retention. We need to be able to retain, because if you guys are struggling with hiring, there's a lot of good time that we're reactivation, or we're doing more reactive hiring versus proactive. And if you have a retention issue, it's usually because of a couple things. Star performers crave 4 things. Star performers crave standards, right? So that's going to be your mission, vision, core values, goal. This is all the caught, not taught stuff, right? It's all like say what you mean and mean what you say, right? They want to make sure that they are aligned and everybody there knows the standard of the company. Number 2 is they want to be taught. They want mentorship. They want, more specifically, structured mentorship. Number 3 is they want a career ascension plan, right? So if they just show up, treat their patients, do their notes, and go home, they're going to find somewhere else to ascend because there's not a big enough shell for them to fit their career inside of. And lastly, they need recognition and praise. So if you could couple standards with teaching, ascension, and recognition, then you'll be able to retain your staff. More importantly, there's actually a really good study that shows that if you just add recognition to star performers, it can improve your culture and retention by almost 60%. Okay. So what I want you guys to do to wrap up kind of where we're at here is I want you to sit here and I want you to rank these from 0 to 5. When it comes to package, recruitment, opt-in, vet, interview, decide, enroll, and retain. And I want you to kind of rate these things. And we got 1, 2, 3, 4, 5, 6, 7, 8. 5 times 8 is 40. So I want you to be able to grade yourself on a scale of 0 all the way up to 40 here. So realistically, if you're anywhere between 0 and 15, or you're between 15 and 30, and you're anywhere between 30 and 40, this is kind of where I'll kind of bump this up here. Let's do 0 to 20. Kind of looking at my numbers and I'm like, let's do 0 to 20 here. Let's do 20 to 35, and let's do 35 to 40. Okay. So this is where we're going to be green. Okay. This is where we're going to be kind of like yellow. We have some work to do. And this is where we have like code red. Okay. So what I want you guys to understand is wherever your first red dot kind of pops up, that is your constraint. That is what you need to fix. So if you're like, nope, this is green, and then we get a red here at recruitment, then we're going to fix recruitment. If we're like, no, this is pretty good. Opt-in, I could get a little bit better. Vetting is not terrible. But then the interview, for whatever reason, I bring people into the interview and nobody moves past it. Great. We're going to work on an interview. Okay. So if you guys want to learn more about this information, we actually have a workshop coming up. So if you want to click on the link in the description or in the comment section and join our actual provider workshop, we're going to teach different strategies here for you guys to be able to fill your pipelines and be able to have providers on demand. So hopefully you guys gain some value in this one. Figure out where exactly you are inside the funnel here, and then I'll see you guys on that workshop.